Hi guys, I'm Dr. Poddar. I'm a cosmetic plastic surgeon, founder at Savannah Aesthetics and Clinic in Ahmedabad, India. We have a very special guest who is a friend of mine since last 13 years, and he is a body contouring, body transformation specialist and is a bodybuilder himself. So Dr. Hardik Ganatra, we would love to have a word with you.
Thanks, Dr. Meet. It's been, 13 years since I know you. It's been a long time. And I remember you were in Dubai, you came over for your journey as well. And so for the audience, I'm Dr. Hardik Ganatra. I'm a specialist plastic surgeon. I'm a body transformation specialist. Like Dr. Meet generously introduced me, I specialize in body contouring, which includes liposuction, tummy tucks, basically fat removal right from the head all the way to the toe. And I do a lot of other surgeries as well. Besides that, I'm also a natural bodybuilder. So I also have a generous 23 years experience in bodybuilding. And thanks, Dr. Meet, for having me here. I'm looking forward to this conversation.
Absolutely. We are going to have so much fun today. So it has been 10 years, like you just mentioned, and I know you from our medical training days. You have worked for 10 years in Dubai, and lately you have started to come to India as well.
Sure.
So you have been exposed to both kind of aesthetic scenarios. Dubai is an upcoming, destination for cosmetic surgeries. So what's your take on the aesthetic scenario in Dubai?
So rightly said, Dubai is coming up in a big way. Like people say, welcome to Dubai, Habibi.
Yeah.
So Dubai, not just for general tourism, for medical tourism, it's becoming a fantastic destination.
Mm-hmm.
The good side being we've got specialists from all over the world. We've got Latin American surgeons, Indians, Arabic surgeons, all kinds of surgeons who come up with their own niche specialty. Which is amazing. As an Indian doctor, we pride ourselves in being honest, delivering high quality results and being very close to the patients in terms of providing them personal care, psychological support during the entire journey. So our patients love Indian doctors and we genuinely take pride in that. But Dubai is a fantastic destination otherwise also, and you've been there, so I'm sure you love the place.
Thanks to you. So for those who don't know me, I'm Dr. Poddar. I'm a cosmetic plastic surgeon. Dr. Hardik has been a mentor to me. It is because of him that I chose this industry, plastic surgery and the aesthetics, and he has guided me throughout. He has helped me get in touch with my mentors, and I'm eternally grateful to you.
Pleasure.
Now that you have been coming to India, what would you say? I mean, are you grateful to your journey, to your training in India, and then you are getting to work abroad? So did medical training in India help you hone up your skills better, or it was what you learned abroad after your journey in India?
That's a very good question actually, because a lot of people discredit our medical residency. They feel that you don't learn any cosmetic in residency, so what is the point of residency? Because honestly, I did not do any liposuctions or breast augmentations.
I mean, we belong to the same institute.
Exactly. So we never did all of that in our residency. But now, once you get out of the residency is when you actually learn cosmetic surgery. So a lot of people discredit the residency, like why did we even do this residency? But the whole point here is residency gives you a generalized skill in plastic surgery. And for all the audiences who do not know what plastic surgery is about, plastic surgery is not just about, it's not about plastics. So just to let you know, because they think like, we'll just get some plastic and you can put it on us. That's not plastic surgery. Neither is just about silicone implants all the time. But plastic surgery involves reconstruction. Reconstruction could be either after trauma, which means someone has an accident, they have an exposed bone, they have a jaw fracture or something, and that's when we treat those fractures. This is done by us as plastic surgeons, right?
Yeah, I mean, not a lot of people know that.
Know about that, yes. Burns is treated by us. I'm sure in our institute, we used to treat like hundreds of burns patients in a day.
I was scared of the dressings of burns. I mean, I remember calling you once and I was like, Dr. Hardik, I would love to be in plastic surgery, but treating so many burns patients, doesn't it get tiring? I mean, don't you get nightmares? What if the patients don't
survive? They don't make it, of course. Burns is of course a very emotional disease, and it's not just physical disease, because people go through a lot and there is a high mortality rate. If someone's 80-90% or more, the chances of survival are quite low, sadly, and we're of course coming up with new advancements in sciences. But yes, so burns is another part, reconstruction after trauma is another part, but there is also post-oncological reconstruction, which means after cancer, right? We've got so many, like in our hospital, civil hospital, we had a huge cancer unit.
Absolutely.
And after each cancer surgery, we used to be called for reconstruction. Doctor, can you come over, put some meat, put some flesh on that open wound,
Absolutely.
right? So that's called post-oncological reconstruction, like how Angelina Jolie had a breast reconstruction, you know about that, right? So this is important for the audience to know, Angelina Jolie, her mother had breast cancer, following which she was detected to have the BRCA gene, BRCA1, BRCA2 gene. She had this genetic mutation, which is why she decided to get prophylactic mastectomy, which means she did not have breast cancer, but she wanted to get the breasts removed so that she does not accidentally happen to know that she's got cancer, and that is advanced to late stages. So, and then she got the cancer surgery done and a reconstruction done. So right now, if you look at Angelina Jolie, her breasts look like they were as good as new.
Absolutely.
And that's the beauty of plastic surgery. That's what we are known for. So plastic surgery is not just cosmetic surgery. This is what we learned. All of this is what we learned in our residency, following which we get to know what we want to do. So after residency, I got to know that I would like to explore the creative side of this journey. That's when I got into cosmetic surgeries, you know, getting to play around with tissues, you know, like doing flaps, like doing removing fat, adding volume. So plastic surgery, you know, cosmetic surgery is a lot about addition and subtraction. Someone's got bigger breasts, you go for breast reductions. Someone's got smaller breasts, you add volume in the form of an implant or fat transfer. So adding, subtracting.
Jokingly, my friends tell me that, okay, Meet, you do hair removal with lasers as well, and you add hair for balding men as well. So बाल हो कि नहीं हो, आपको आना ही पड़ेगा मीत के पास, right?
Exactly. I mean, that's how it is, right? You want to add something, you want to remove something, you still come to us.
Yeah, exactly.
That's the beauty of this specialty. So post residency, I got myself exposed into cosmetic surgery, which is when I decided that yes, I want to become a cosmetic surgeon only.
Yeah.
Following my journey in cosmetic surgery, following the entry into cosmetic surgery, I realized that what excites me the most out of body, breast, genital surgeries, you know, a lot of
anti-aging.
face surgeries, anti-aging surgeries, a lot of surgeries, I realized that what I love the most is body contouring. Also my experience in bodybuilding, I've been training for
absolutely.
23 years in the gym now.
Now you can safely say that you understand body.
Absolutely. So, of course, it's a journey in progress, and of course, you know, we all have got in the mind we need to be humble. We know so much, but also we still don't know so much.
Absolutely.
So we're always learning, right?
So now that you spoke about residency and choosing your careers, let me tell you my experience with the residency. And you remember how I called you up one fine day that, Dr. Hardik, I am confused. You know, even after getting plastic surgery, there are so many fields to select from.
Subspecialties to select.
And, and you helped me get through that. And thanks to you and of course my mentors who helped me reach here. Now, this is the same dilemma that the new age surgeons, new plastic surgeons are going through, and lot of people, you know, I'm sure you must be getting such DMs as well. Lot of people call me up, lot of people send us DM on Instagrams, and they are facing more or less the same dilemma that I used to face. You were lucky enough, I was lucky enough to have such guidance. So I try my level best to guide them. But what would you say to those aspiring cosmetic surgeons?
So for all the young aspiring budding plastic surgeons, I tell them that there is a lot of light at the end of the tunnel, because you know, every time it's like I can't see any light, I don't know what to pick up. Should I go into burn? Should I go into reconstruction? Should I go into cosmetic? Should I be in Dubai? Should I be in India? There's just so many dilemmas to all the young plastic surgeons, and rightfully so. You know, this is a generation, this is an era of problem of choice. Everyone's filled up with so many choices and options that we struggle to decide on one thing. Of course, I ask them, these young plastic surgeons, to get exposed into various subspecialties. Go to people who do exclusive trainings. Go to people who do general trainings. So my primary advice is, guys, first go to a general cosmetic surgeon. Some surgeons, some amazing plastic surgeons in India and abroad who do all kinds of cosmetic surgeries. They're very good in a lot of surgeries. They're doing face, hair, body, breast, everything. You go to them, get an exposure of everything. Following which, you decide that, okay, I think I would like to get further training in breast surgeries.
Yeah.
That's when you choose a breast specialist to go to. If you need a body specialist, I'm here for you. You could come over to me. We also offer fellowships where you could come in. Then I would happily mentor the students. Following this, you then get to have a better perspective of what you want to do in future.
Exactly, and it is a never-ending process. I mean, you one fine day you just decide that okay, I want to become a breast surgeon, and then you start doing breast implants and breast reductions. That is not the end of it. I mean, from what we have learned is that you keep attending conferences, you keep getting in touch with those who are doing better, those who have made better names and coming up with different techniques. So it's a never-ending process. You
Learning never
eventually-
stops for
Yeah,
us.
learning never
True.
stops. Yeah. So. What we as young surgeons do, we have decided that 15 days a year should be the minimum amount of time that we have to spend behind a certain technique that we wish to learn and own the skills for. And whatever it takes, I mean, visiting a specialist in India or going abroad
Or attending conferences, workshops.
yeah,
There are
hands-on
so many
workshops.
things,
Yeah,
small-term
absolutely.
fellowships as well. So many things to do, It's just that the hesitation to learn is financial, because a
Yeah.
lot of people feel that it's expensive. See, young plastic surgeons fail to realize that this is investment. You
Exactly.
are your biggest investment.
Absolutely.
If you invest in learning a particular skill, you're going to make millions out of it. Money is a byproduct. My brother used to always tell me, this is like a brilliant businessman. I love him to bits. And he keeps telling me back home, whenever I visit, he keeps telling me this thing. He's like, money is a byproduct of success. You don't chase money. You chase success. You chase good work, and money will follow. So this is what learning. You need to put in money to learn, because there is a lot of investment that a lot of mentors do in terms of giving time,
100%.
energy, approvals and permissions and resources to train someone. So finances is number one. Second hesitation to a lot of people is the distance, leaving their families, which understandably so. I'm not married. I probably would not put myself in your
Okay,
shoes.
that's an entirely different topic that we need to discuss. But
But
yeah.
sure, that's a bit. I'm sure that's going to be a little embarrassing. But see, like they say, no guts, no glory. So you need to go in. You need to go to uncharted territories. When I came to Dubai, I had absolutely no clue about what Dubai is about. I moved in. That was the first country I moved to.
Yeah.
So I've never lived anywhere besides my own city, and the first place I go after my own city is directly another country, a new country, different language, different culture. But then if I did not do it, I would not have learned what I learned, and I would not be doing what I do, right?
Correct.
So that hesitation of, should I go out? It's a different place, will those
basically
people,
being in-
language, culture.
Being
Be
in your
open.
comfort zone.
Get out
People
of
get-
that,
yeah.
the
Yeah,
effing
yeah,
comfort
absolutely.
zone, because growth happens out of
your
your
comfort
comfort zone.
Because being in India, being close to your family with your parents, everything is, the rest of the things are taken care of. आपका laundry हो रहा है, आपका both meals are sorted. I'm
Absolutely.
sure being a single guy, you are single, right?
Yeah, yeah, I am. Yeah,
Yeah.
I am.
So, okay. Let me just put an end to that question once and for all.
Okay.
बहुत लोग पूछते होंगे आपको. I'm sure you must be getting hit upon as well. And let's put that question to rest. Is Dr. Hardik Ganatra single?
Yeah, I'm very much straight. I'm very much single. I'm very much at peace by myself. Yeah, of course, I do understand the value or the virtue of a relationship, and I do know that a relationship gives us a different kind of joy. I always tell my friends, and who've already been married, so I'm sure they know about it, but always tell younger guys like yourself, I tell them that life is not just about work, of course, and I love to work. I'm a big time workaholic, but life's not just about work. Life is about, having a good personal life as well. But somewhere down the line, it's a very fine balance, and I've probably not been able to achieve that balance yet, which is why, I'm more towards work, profession, self-improvement, self-development at this stage.
But you are open to mingling, right?
Yeah, I mean, Yeah, well, I'm open, but not virtually open to everyone in the market. That would be a
Okay,
little.
so I mean, our viewers would get a hint that okay,
No. But I'm sure the viewers should know that this is not an open invitation to anyone. I love to work.
Yeah.
Honestly, and I would hate. I say this to myself, and I say this to a lot of people who genuinely care about me, like yourself, who tell me to get more active into my personal life. I tell them that my work forms is why work and workout makes me. My friends who know me since past probably 15-20 years now, they still know that what defines me is my work, because I love to work, and my workout. So I would hate to derail my focus. So if something adds to my focus,
So
something or someone
yeah.
adds to this focus, helps me to become a better version of myself, I'm really open to that. But if something is going to probably be a distraction,
So that is where I was getting at. It's not necessary that she is going to be a distraction.
Of course.
Being happily married for since last 8 years.
and you have a lovely daughter as well.
Yeah. So I believe that my partner, Shaili, you met Shaili,
We've
right?
met her. Yeah.
So she has been working since last 14 years, and she understands the value of work and the time that we give to family as well. And somehow, I mean, being such a good friend of yours, you've seen that meme, that Rahul Gandhi's meme, right? ये जो मजा है वो मैं देश के हर व्यक्ति को देना चाहता हूँ. So when you are married, you want everyone else to be married as well, so that you can go out on couple outings, right? Why not?
Yeah, I just jokingly say the same thing, but I translate into another language. I say I have so much of love that I can give it to one person. That sounds very promiscuous. I'm not, trust me, but I'm just.
All right. So, moving ahead, I mean, in India, there is a lot of fuss about HD liposuction. I mean,
They don't even know what HD is basically.
So, honestly, I got to learn about HD liposuction through your posts during my training, of course. So, there are two different mindsets regarding HD liposuction in India. From what I have seen is, there is one generation of plastic surgeons who believe that ये सब fad है, there is no need of undergoing something like this. Indians are not designed like that. And then there is a younger generation of trainee young plastic surgeons who wish to straight away go for, I want to give the best results that I see on Instagram and do HD liposuction for every single patient. So what is your take on HD liposuction and its feasibility in Indian scenario?
So that's a very, very good question actually, because I do come across this dilemma with surgeons as well, because the older generation surgeons, and I'm sort of falling into the older generation now, so we're getting all grey now, but the older generation surgeons do have a bit of hesitation against this surgery. They believe that go to the gym and then you can get abs, or other guys who are using anabolic steroids have abs, but we don't do such fancy surgeries. They feel that this is too fancy for them.
Yeah.
While then the younger generation surgeons who are like, I just want to do HD liposuction. I just want abs on every single person. And I'm like, guys, it's not black and white. It's like that's not how life is, right? Life is all about grays, more grays than actually black and white.
Yeah.
So for the older generation surgeons, well, HD liposuction has a bit of growth curve, and they might have this hesitation, but I would really urge them to learn this technique as well, because it's beautiful. It's very, very creative. It's like you give me a marble, and I want to, a block of marble, and I want to create a sculpture out of it. So it's beautiful. For the younger surgeons, guys, just chill the F out. Not every patient is a candidate for HD liposuctions. There are patients who've got a lot of loose skin. They're not good candidates for HD liposuction, because I could be a muscular guy, but if I wear a XL t-shirt, you don't see any muscles on me. Why? Because the external cover is not designed for what is there inside.
Exactly.
So the content and the container are not resemblant. So I see
They should be the right fit.
They should be the right fit, exactly. Yeah. And for the right fit, what we do, if there's no right fit, that's when we remove the extra skin, and that is called a tummy tuck. So if I've got patients with a lot of excess skin, I tell them, guys, allow me to first remove that excess skin. I remove it, get you into the right fit, and then I can probably do a second session where I can do the HD liposuction for you. This is number one, which is the skin. Second thing is visceral fat. I'm sure you know about visceral fat.
Yeah,
We all,
absolutely.
like our patients, they come up with this problem of visceral fat, but they don't know about what visceral fat is. Visceral fat is the fat around the organ. Viscera means the organs.
Organs.
So the fat around the organs is called visceral fat. People tend to have a lot of visceral fat. Now, I could probably have a lot of visceral fat, which is bulging out. And I have some fat above on the skin as well. I remove that fat and I create abs, but I still have that bulge, and that bulge is because of the internal fat.
That
Now
is pushing the belly out.
That's
Yeah.
pushing the belly out. So if I do HD liposuction for such people, it's going to look like a ninja turtle, like a big belly, like a pot belly with
This is something that we see in, a lot of patients in Indian scenario, average Indian belly, pot belly
Pot
that they
be-
say.
yeah, we say the Indian obesity,
Yeah, I mean, my patients who from this part of the country, they are like, we are baniyas, we are vaniya, to vaniya જેવું પેટ છે અમારું,
Yeah,
મારવાડી
sure,
belly, right?
sure.
So they tend to have this notion that, okay, we have a job that requires us to sit for extended hours, and that is the reason पेट ही बाहर आ गया है.
So they feel that this is inevitable.
Yeah.
That the stomach, the gut will stick out because that's just how our job is.
Yeah.
And B, that they don't want to strive to improve it.
Yeah.
Because they've kind of accepted it, So there are two kinds of notions in cosmetic surgeries. One is acceptance and one is denial.
Yeah.
Unfortunately, both of these are important, but unfortunately, both of these happen for the wrong reasons. They are accepting the pot belly and they are denying the fact that they can also achieve a good shape. I'm like, guys, that's not how it should be.
Yeah.
So for that visceral fat or the pot belly, what works best is diet and exercise. You work out, you increase your calorie expenditure. Go for a run, go for a jog. Please don't tell me you will be walking for 5 kilometers and walking does not burn calories.
But has any such patient ever told you कि डॉक्टर ये सब हमसे होता तो आपके पास क्यों आते?
Yes, they would have come in. Patients do come to me and tell me, Doc, if I could do it with diet and exercise, why would I come to you?
Yeah.
Sure. My question to them is, will you be wanting to do diet and exercise after my surgery? If the answer is no, they're not good patients for me.
Exactly.
Because these are going to be unhappy patients because I can only do so much. I can only remove the fat under the skin, not under the muscle. The fat removal under the muscle is their job.
And I like to add to my patients that पुराने पाप धोने में help कर सकते हैं हम, नए पाप नहीं करो.
We can undo the past.
Yeah, exactly.
We can undo the past, but we can't prevent
Control
the
the future.
future. So I get a lot of patients who come and tell me, Doc, you will remove fat in this area.
Yeah.
And great. But after that, you are telling me, will the fat come here? I'm like, the fat will not come here as much. But fat can come in other areas. So why should I do the liposuction? I'm like,
But why?
You should.
Why do you want to fat the?
Why do you gain fat in the other areas for the first?
Exactly.
And you want to make sure you use this liposuction as a push or a motivation. So the
can be a jump start, yeah.
Exactly. So the actual answer to your question is, after you are doing you are on a regimental diet as strict as you can be. I don't want you to be starving. I want you to be as strict as you can possibly be. Few cheat meals a week is okay. After you are on a good consistent diet, after you are doing a good you are on a good exercise regime, which means you're working out. For some people it would be 6 days a week, for some people it would be 3 days a week. But if you are doing as much as you can in terms of diet and exercise, and if you still are struggling, I will give you a jump start, and with my jump start, you will be able to achieve your goal results much faster. Right? But this is not a shortcut. Liposuction is not a shortcut to achieving a Hrithik Roshan or, like a
teamwork,
Daniel Craig or a Superman like body.
So it is teamwork, of course. That's what you mean to say.
Always. Even when I post results, I always acknowledge the efforts of patients. I write down in the captions, this result is a teamwork and the patient has worked as hard as me.
True.
I would be lying. I would be posting myself as a magician or God if I say it's only me, and that's wrong.
So probably that is the reason, we as Indian doctors are not usually in favor of HD liposuctions, because the kind of patients that we get, we are used to doing debulking liposuctions.
Debulking is like a slim down liposuction. Bigger people coming in, you make them small.
So, people like you and me who would want better definition maybe, or getting rid of some fat.
Stubborn fat,
we
small
still like
stubborn.
we still like to believe that, okay, this I might be able to lose with 6 months of efforts, which I never do. But yeah, I still like to believe that, okay, I might be able to do that. And why would I need to go a cosmetic surgery for that?
Sure.
And people who wish to get slimmed down, and they have been recommended bariatric surgery, for example. They are scared of bariatric surgery. They don't want to go for bariatric surgery. Such patients usually come to us and they are like, doctor, do 2-3 procedures if you wish. Don't worry about the money. I am scared of bariatric surgery, and do a liposuction for me. So I mean,
so bariatric. So I have a very staunch role on bariatric surgery, and I think we discussed this a few days back. Bariatric surgery was founded for morbid obesity. Morbid obesity is obesity which debilitates you, which hampers you from your daily activities. You're not able to go walk around, jog around, you're panting and puffing, you've got diabetes, you've got asthma, you've got other problems, metabolic problems because of that obesity. That is called morbid obesity, and that's how bariatric procedures came in. Bariatric procedures did not come for people like you and me.
Weight loss,
it did not come for people, it did not come for just a casual weight loss. Like, hey doc, I want to get rid of 10 kilos. Should I go for a bariatric surgery? Are you out of your effing mind? Why would you want to get a bariatric surgery done? Right? Because bariatric surgery is no fun. It could even be irreversible. You're cutting your stomach down, So you could have vitamin deficiencies and all of, a lot of vomiting, nausea, and so many other problems. So bariatric surgery has a role. It is amazing. One of the best surgeries which has been founded by gastrosurgeons.
But in selected patients.
In selected patients. So not everything is for everyone. And to know whether something is for you or not, go to the right professional. Don't just go and Google it and say, okay, I want to lose 20 kilos, what to do? Get a bariatric surgery done. That, the chat GPT would tell you, get a bariatric surgery done. So you end up on a bariatric surgeon's table. That surgeon might, all respect for all the surgeons, by the way, that surgeon might want to make a shit lot of money, and he would say, oh, you want 10 kilo weight loss? Come over, jump in. I'll remove. And yes, you will lose 10 kilo weight loss, but you will not just lose 10 kilo weight loss. You are going to lose probably 30-40 kilos of weight loss, and you are going to be looking miserable. You're going to be looking skinny. You're going to have a lot of loose hanging skin anywhere. Are you really going to be happy with that? Happy on the scale? Yes. You got from 90 kilos, you became 45 kilos.
But at the cost of what?
What's the price you're paying? You're paying the price in the form of deficiencies, in terms of not being able to eat more than half a salad or something. Is that the life that you really want?
After that, probably you will need 5 more plastic surgeries.
5 more plastic surgeries to get, and 5 more plastic
chest lift,
and Dr. Meet, it's not just 5 more plastic. It's 5 more plastic surgeries with a cut, with a permanent scar.
Absolutely.
And then people want to believe, again, the denial part. My patients come and they tell me, but will the scar be visible? Of course, yes, it's going to be visible. If you have a darker skin type, your scars are even going to be darker. That's just the reality of it. If plastic surgeons say your scars are going to be invisible, come on, do you really buy that?
Absolutely not. So that is what, just that patient today we had for consultation for a tummy tuck.
Yep.
He wanted to hear that, okay, scars will go away, right, eventually.
Exactly. That's what he wanted to hear. But our job as ethical plastic surgeons is to tell them the truth. And the truth is based on scientific facts. I don't design the truth. No one does. We find out the truth based on the scientific facts which have been studied by people for donkey years on thousands of patients.
True.
That's the truth and the whole truth, and that is what we give to the patient. Now, if they do not accept the scars and they don't want the surgery, God be with them. They could very well go to another surgeon. But I don't want to do something which is against my medical ethics, because that's wrong. Because at the end of the day, what do we want to do? As surgeons, we want to come back home, face ourselves in the mirror, right?
Correct.
And we don't want to go home feeling that we did the wrong thing.
Dr. Hardik, बहुत heavy हो गया.
Sure.
Let's on a lighter note.
Sure.
I'm sure you must be getting this a lot, that you look like somebody, some cricketer, not wanting to name him. Lot of my patients tell me that आपके साथ में जो डॉक्टर हैं, डॉक्टर हार्दिक गणात्रा, वो पिछले साल से अभी और जवान लगने लगे. वो क्या करते हैं? So, I mean, what's the secret? I mean, have you, of course, bodybuilding and you are into good diet, but उसके अलावा कुछ कहीं ना कहीं कुछ
No. I've not been taking. I wouldn't lie to the audience if I tell you that I've not been tempted to take steroids, because more steroids means more muscles. But and a lot of vitality and everything. Testosterone is amazing, as a drug, and I'm not trying to tempt anyone here. I personally don't even take it because of the side effects and everything, and I want to go down that route.
True.
But I think a good diet, absolutely, like you rightly mentioned, good diet is important, and a good diet doesn't mean I don't cheat. Like today itself, we had this vada pav, right? Vada pav is an Indian dish, which is
You loved it, right? Since after so many years.
I gobbled it up like a hungry dog. So yeah, I do indulge in cheat meals. I do miss my workouts sometimes, although I don't like to, for my mental sanity more than the muscles, But I do miss my workouts sometimes. But overall, I feel besides this, I also focus on skincare, retinol at night, sunscreen when you go out, vitamin C serums, very important. Of course, a little bit of Botox and fillers. I'd be lying if I say I don't have Botox right now. Like this is kicked in, so you'd see my forehead is probably super shiny as a shiny, a shiny shoe or something. So that's Botox talking right now. Also, of course, a little bit of fillers and stuff would help you. Add under eye fillers, because that I probably look quite sick when I lost some weight. So I have a bit of under eye fillers, which makes me look fresher. So of course, I do pamper myself, or I do indulge myself in some treatments now and then. I do talk about it openly. I do post about chemical peels and lasers that I get. I'm a big, I wouldn't say fan, but I'm a big proponent, or a promoter of lasers and stuff for anti-aging. Because come on, guys, I'm much older than you, much older than most of the people in this room, all my team.
The way camera team सुन लिया answer. They were just asking us कि भाई आप इतने दिखते नहीं हो जितने आप हो. But of course it takes efforts from.
It is a lot of effort.
It takes discipline. It takes some medical help as well, and there is
no shame in it. Absolutely, there is no shame.
I mean, you did my fillers, and
Under eye fillers,
I'm so happy after it that I'm coming to you every year, that this is something I cannot go back to my previous look.
Absolutely.
And like you said, retinol for anti-aging. The moment I start to notice some hair loss, I'm like getting PRP done and
everything. So
absolutely.
So you self-care is self-love, So that is important.
Like you said, investment in self is the best investment. अगर मैं SIP कर रहा हूँ बैठ के, and I'm purchasing land in the outskirts of the city.
Yeah, real estate and everything, it doesn't make. This is what I was discussing with the previous patient today in our consultation. You are your biggest investment.
Exactly.
So if you overlook yourself, and then you are investing in gold, real estate, stock market and everything, and you don't look and feel good. And trust me when I say this to the audience as well, I'm not just all about looks. Of course, everyone wants to look good. And trust me, if anyone tells me, I really don't care to look good, come on, who are you lying to?
Yeah, exactly.
Who are you lying to?
I love that reference of yours, that driving a 2 crore ki BMW and not looking the way you wish is not something you would want to go for. I would be happy in a Verna and looking the way I want.
Looking the way I want to. Yeah, so that's the same thing. You want to be your best version.
Absolutely.
And if with plastic surgeries, be it surgeries, hair transplants, gynecomastia surgeries, liposuction surgeries, whatever it is, if we with surgeries or non-surgical treatments, if we can be the best version of ourselves, why not?
And when the help is available, it is, there is no shame in actually going and inquiring about it, right?
It is so funny if I tell you that I actually shame plastic surgery shamers.
Yeah.
So like if you shame plastic surgery, I'm going to double shame you.
I've seen you.
I'm going to double shame you. And I openly do that because I don't, because I'm too old to be caring whether people like me or not. But B, these surgeries were designed for a reason. Now, again, I do understand a lot of audience will be like, oh, so you're promoting plastic surgery because you make money, or you just want everyone to look like celebrity. Not everyone wants to look like that. God be with you. If you're happy with the way you look, more power to you. Trust me on that. But if you're unhappy with it, then there is a choice. That is all I want to say. It's just as simple as that.
Exactly. who are you to judge if somebody wants to get something done, if not?
Exactly.
People love to gossip about.
Oh, look at
Savannah.
her lips. Oh, look at her
Yeah,
breasts.
this
Oh, look
actress-
at her bums.
this
Look at that
actress,
actress.
yeah, this
Oh,
actress
which
did
one?
this one.
Shruti Hassan did her nose.
So what I tell my patients usually is there are two types of plastic surgery shamers. One of those who are so orthodox and set in their own ways that they don't want to believe that anything else can be correct apart from their own version of it. Or second, who don't have the resources to actually go through something
Yeah, the
like this.
resources could be, they could be in a location where plastic
Yeah.
surgery is not available,
Yeah.
good facilities are not available. They might be financially,
Incapable. Well, I mean,
incapable.
yeah.
And there is no shaming to that. But see, Dr. Meet, it's just very, this is again a little, I don't want to get the conversation really serious, but when it comes to finances also, I know plastic surgeries could be very expensive, and the more experienced surgeon you go to, the more expensive the surgery
Absolutely.
becomes, because you're paying not just for the results, you're paying for the
Entire
entire
experience.
experience, right? But what we need to realize is that this is all an investment. When I am spending for a 5 lakh rupee surgery, or if let's say I spend for a 4 million dirham apartment, comes to about 10 crores.
Yeah.
If I cannot afford it right now, I don't have any shame in that.
Yeah.
I am happy to admit that I cannot afford a 4 million dirham apartment even on mortgage, because I still need to pay the down payment, right? I am happy to admit I cannot right now. But if I cannot do it right now, I would work harder towards managing my finances better,
Yeah.
so that next year or 2 years down the line, I can come back strong and I can say, now I can afford this apartment, and I will buy.
Exactly.
The same with yourself. If you cannot afford a particular body contouring surgery with a particular surgeon, whoever it will be, me, you, or someone else, save up, manage your finances. You don't need to. Rather, I tell my patients, please don't take a loan. Please don't rob yourself of finances and take all your money out from all the savings and do surgery with me. I don't want that money.
Also, don't compromise.
That's what, and don't.
Yeah.
So, don't ruin your savings, don't ruin
Yeah.
your finances and come to me, because I feel bad. Because I feel guilty of like robbing you, and I'm not robbing you, because I've got my own experience which is worthy of a lot. At the same time, I tell you, don't compromise and go in for cheaper surgeries,
Exactly.
because there is a cost to everything. We do it in a very credible facility.
Yeah.
Like your facility is accredited, everything with proper general anesthesia setup and everything. The same you could do it in a very small setup, very mediocre average setup.
Yeah.
And you could offer that in much cheaper rates.
Yeah.
Question is it going to be safe for the patients?
That's what I
If
mean.
it's not, then
yeah.
should a patient come to you when you're doing it in a very mediocre, unsafe setup? No, right? It's just as simple as it. So, again, investment. Good investment need good money, and you need to save up. You need to make sure you're financially stable, and then go ahead with the surgery.
Perfect. So, Dr. Hardik, thank you for your valuable time and insights. It was a pleasure having you over. Our conversations are never ending. I mean, I can go on and on,
Same,
but
same.
we'll save some for the next podcast.
course.
And thank you again. Over to you.
Pleasure, man. Pleasure. It's always a pleasure visiting you and the entire team. Your team is lovely, and I would love to catch up for another session as well. I'm sure it's going to be very insightful and helpful for doctors and other plastic surgeons. Yeah.
Oh, I'm sure our viewers are going to enjoy what we had to discuss today, right?
Sure. So we have a big case coming up tomorrow. So
Perfect.
see you there, man.
Can't wait to have you over.